welcome back to Mobility, Dr. T, Dr. Bubbs, and we have our first guest, Dr. Erin Wiley. How are you?
Good, thanks for having me.
So
it's a big honor to be the first guest on Mobility.
Oh wow, that's fantastic.
This is awesome. So one of the things that me and Dr. Bubbs were talking about was like the first system that we developed, right, is our core. And one of the key things is like it gives us a lot of stability, right? So you want to think of it in terms of the diaphragm, the pelvic floor, the abdominals, and the multifidi muscles, right?
Most people are good at thinking about the front of the core, but we tend to forget about the back of the core, the bottom, right?
Yeah. And the way I was thinking of it was like it's the house, right? You know, you got the basement and you got the roof. Those are the things that you really care about. But everybody's worried about the curb appeal, right? They want to really look good here and that, right? So let's get the basement in order and talk to us about the pelvic floor.
All right, well the pelvic floor is important for everyone, but particularly with women's health. I know for myself, after I had my first baby, it was definitely an area that I wanted to address so that I could get back to an active lifestyle and not risk a lot of injury or stress to the rest of my body.
Mm-hmm. So tell us in terms of like what is the move? Are they a particular position you like to do them in, or?
The move is really simple. So why don't we try to do it together? So if you can imagine a diamond at the base of your pelvis. So you want to connect your pubic bone and your sits bones and your tailbone. Okay, so a diamond. And we want to imagine pulling those points together. So you're engaging your pelvic floor muscles and you're drawing those 4 points in. Can you feel it?
Okay.
Now some people like to use the analogy of preventing yourself from going to the bathroom, either number 1, number 2, is there any of that involved?
Yeah, no, definitely. It's just like holding it, so, you know, when you're rushing to the washroom.
Yeah, so if you're sitting at your desk right now, if you're standing in line for the subway, you could be actively participating here, right?
Yeah. If you want to take it one step further, you can use a visual tool. See if you can imagine using those muscles, and we have a saying called picking up the blueberry. So if you can imagine pulling those muscles together, and you're going to pick up that blueberry, and I want you to take it to the first floor. See if you can hold it. Okay, and let it go. And take it this time with your breath, so take a nice breath in and pick up that blueberry. And now see if you can take it to the first floor and the second floor.
How many floors?
Yeah, this is hard.
Fourth floor. So let's see if we can take it all the way up to the fourth floor. So taking another deep breath in, pick up that blueberry, bring it to the first floor, a little bit higher second floor, a little bit higher third floor, and to the fourth floor, and let it go.
That takes more concentration than you'd think, right?
Absolutely. It's definitely about the mind connecting to those muscles. Often it's not about the muscle strength, it's just that we lack that connection.
Yeah, definitely.
Because also the other thing that is happening is like that motion, it activates your parasympathetic, so there's a lot of wonderful things that ends up happening as well. Because, I mean, from my perspective, you got two roles. You got the sphincters that they need to tighten up, and then the pelvic floor is like this sort of emotion that goes up as well, right? And this is also very crucial for men as well. So it's not really something that is need to be exclusive for women, right?
Absolutely.
So is there one that you would do lying down?
Sure. If you're ready to take it to the next level, we can also try to do it while we are engaging our glutes and our hamstrings. So a good exercise is to take it down on the mat. And again, you want to take a nice deep breath in, engage that pelvic floor, and when you feel it stable, you want to see if you can elevate your hips.
So now we're getting a bit of pelvic stability with some movement at the same time, is that it?
Exactly. And you can lower down. And this can take a while. If your pelvic floor is not stable, you don't want to really rush the levels. But eventually, if you're ready, you know you can pick it up. And then you can try to move one leg. And then the next.
I think she's showing off right now. I mean, this is, I don't know, I think this is a very complex.
What about for the person who struggles to kind of feel it, or they're not sure if they're doing
it
correctly or something?
It just takes a lot of practice. And you can go to a physiotherapist and have an internal exam if you're really having trouble engaging.
But just taking their time, doing it daily or every few days would be enough.
Yeah, when you're sitting in the car, when you're stopped at a red light, you know, every time you go to have a glass of water, it's one of those things that you need to repeat over and over and over again.
So the other thing that I like to do is like what you were saying that is very hard because people feel like they really need to feel it, is that if I be able to, again, engage her adductors, you know, thigh muscle, that's also going to give you a better opportunity to be able to, again, utilize that. So it would be something as basic as having something between your knees, and you can basically do the same move again, right?
And you'd be surprised how much more stability you have when you have that.
Exactly. A yoga block or a pillow.
Exactly. Yeah. So this would be another thing that, you know, you'd be able to, again, to start off with, right? And so this is pretty awesome. Now, the one that I like also is the one you can do it in a quadruped position. And I figured that this will be a great opportunity where we can review some of the stuff that we were talking about before.
Yep.
In terms of some of the stuff that you care about, Dr. Bubbs.
For sure. I mean, it's all about, you know, once you acquire the skill in certain positions, I mean, we often think that it translates to all positions, but it really doesn't. You've got to practice that skill in different areas. So once you've done it standing or a supine lying down, then you can take it to all fours before, again, trying to take it to a standing and moving position, right? So this is terrific, all fours. We did the crawling patterns to start with. So here we just have Aaron engaged from this position. We've got a nice long spine. Again, if we had a dowel, the dowel would be touching the tailbone, the mid-back, the top of the head, so we just tuck the look straight down. Perfect.
This idea of the neck packing, right?
Yeah, we kind of want to tuck that chin in. We have a natural tendency from sitting at the desk to always have the kind of chin up and out, so really kind of tucking in and keeping it nice and long, so you're always feeling like you're looking right down, you know, in front of you as if you were reading the paper or a magazine or something.
Yeah. So now, one thing is that you can basically synchronize your breathing, because the other thing is that it's all about facilitation, but it's also about relaxation that we want to be able to do. So you can actually breathe for me, like through your nose, and then you're just going to sit back. So this notion of a pelvic rocking, and then you exhale. So once you be able to do this movement, then you'll be able to, again, to talk about what Dr. Wiley was talking about, engaging and relaxing.
Yeah, it's really all about that on and off. We're always sometimes so concerned with engaging and turning it on that we forget that it is this idea of being able to engage and being able to release. Right? So
yeah, and you know, I think one thing that happens with a lot of the Kegel exercises, people just do too many, and it causes a lot of stiffness, which is not the best case for a lot of people as well, right? So it's just finding that balance to be able to do. Okay, because remember, diaphragm, pelvic floor, so you got to think about the whole complex.
Perfect. So I'm giving you guys lots of homework this week, so crack into that. Dr. T, last week we had some tips on things and habits that we were going to do. How did you do with your?
I got to tell you, I think I did all right, but it's challenging. I mean, and one of the other things that we were talking about was like, one of the things I heard is like a mind is like a parachute. It only works if it's open, right? So just listening to different podcasts, just like exposing yourself to different thoughts and managing different emotions. So that's also the way I like to go about it.
Nice. I had a coffee-free week last week. I struggled the first few days. It was a little bit rough, but after that, started to feel good towards the end of the week. And this morning was the first coffee in a week. And I tell you what, I got a lot done this morning.
You look good. You look
made
good.
it through.
Yeah. So, all right. Anything else you'd like to add?
No, just keep practicing day in and day out, and before you know it, your pelvic floor will be a lot stronger, and your whole body will be better for it.
Okay.
Until next week.
All right. Thank you.